My name is Maria Lorden Dunphy and I lead the Patient Safety Programme in the HSE, National Quality and Patient Safety Directorate. The Patient Safety Strategy was launched in December 2019, giving significant weight to the many excellent patient safety initiatives directed at making the HSE safer for patients, their families and staff. One of the patient safety priority areas highlighted in the strategy is reducing medication-related harm. This is also the focus of this year's World Patient Safety Day. We know that at least half of medication-related harm is potentially preventable. Medication errors occur for a variety of reasons, and when they do, they have very serious consequences for patients. Our National Medication Safety Programme works with patients and healthcare professionals to reduce harm associated with medicines. The team is leading many measurable improvements in medication safety. We are very proud of the work of our National Medication Safety Programme and grateful for the continued support and energy of colleagues and patients in working towards a shared vision for medication safety and indeed patient safety as a whole in our health service.
My name is Joan Johnston and I'm mom to Leo, age 5, living with Angelman syndrome, a rare neurogenetic condition that means his care can be medically complex. As Maria's mentioned, the theme for this year's World Patient Safety Day is medication without harm. And our family have experienced medication safety incidents with Leo's medications in the past. But I want to take this opportunity to highlight that patient safety means different things to different people across different healthcare settings. Right now, our focus is the physical safety of Leo's environment, constantly looking around and asking ourselves, what could Leo do? You see, Leo is a curious little boy. He enjoys exploring the world around him with his hands in his mouth, while in his gait trainer or combat crawling on the floor, and more recently as a daredevil climber. Hospital visits are challenging. Leo requires constant supervision, as he's a tenacious problem solver and opportunistic risk taker with zero safety awareness. At home, we use a safety bed for sleep as he climbs out of a cot and won't stay in a regular bed. Away from home and in hospital, we must choose between the risk of a fall from a cot or his unrestricted access to the whole room while we sleep. Everything that Leo finds interesting must be explored in his mouth, and healthcare items are particularly interesting. I remember one admission, leaving Leo in his specialist seat while I went to the bathroom down the hall, and I came back to find him happily chewing on the IV line that had been in his neck when I left. I fished other healthcare objects out of his mouth too. Cotton ball and tape when I forgot to remove it after a blood test, his hospital ID bracelet after he chewed it off his wrist, and a CPAP mask that was just no match for his dedicated chewing. We have to be hypervigilant, particularly when Leo is in new environments. So on this World Patient Safety Day, I ask you to consider, what does patient safety mean for you, the people you work with, and the people you care for? If it's the care environment like it is for us with Leo, are there hazards that can be removed or made safe, such as cables, lockers or hot water taps, a firm favourite with Leo? Is there a specialised bed that could be requested, or a floor mat that would make his floor exploration just a little more hygienic? Is the dressing or ID bracelet you're placing secure from curious and industrious little fingers and mouths? Do you regularly ask mom or dad if they need a break to grab something to eat, use the bathroom, or just get a breath of fresh air so children like Leo are never left with unsupervised opportunities for mischief? Look around you today and think, is there anything I could do to make Leo's visit safer? Ask yourself as we do, what could Leo do?
Hello, I'm Colin Henry and I'm the Chief Clinical Officer in the HSE. Maria has told you about our National Quality and Patient Safety Directorate and the Medication Safety Programme, and Joan and Leo have told us and indeed demonstrated some of the patient safety concerns that impact their family. For World Patient Safety Day, I want to restate the HSE's commitment to maintaining patient safety and quality of care at the heart of our service provision. We strive to deliver the highest possible standards of care for patients and support our staff with a safe system of work to enable them to provide a high quality service. As Chief Clinical Officer, my focus is on supporting and initiating programmes of work which strengthen clinical leadership and expertise, develop and nurture collaboration with patients and service users, assure safety and improve the patient and service user experience. Our health system doesn't always get it right. Unfortunately, every day errors and harm happen to patients during the provision of healthcare. Patient harm due to adverse events is one of the leading causes of morbidity and mortality worldwide. The HSE Patient Safety Strategy is clear on its ambition for a compassionate, just, fair and open safety culture in the HSE. We recognise how difficult it is for staff when they're involved in a patient safety incident, and we want to reward their courage in speaking up by working with them to understand and improve the system they work in. I also want to recognise the importance of patient partners in our continuous efforts to improve patient safety. As we saw with Joan and Leo, the voice of patients gives us such a critical perspective on what we as providers should think about when we deliver care. Whether you are a patient or service user, a family member or carer, or one of our valued staff, patient safety is everybody's business. Thank you for listening. Gur maith agaibh uilig.